when Todd and I, in last December 2012, when we were at the San Antonio Breast Cancer Symposium, the hottest story at the San Antonio meeting was continuing tamoxifen for another 5 years.
What are your thoughts on that? I remember instead of just the 5-year plan, now going on for a total of 10.
Right. A lot of debate about it. The British study had many more patients in it, but wasn't quite as tightly controlled as the U.S. study. The U.S. study that was done several years ago, after the first 5 years of tamoxifen, they then randomized patients into two groups, one that had another 5 years and one that did not have another 5 years, followed them out to, so you've got a 10-year follow-up now. We didn't see any difference back then. So this is getting everybody's attention. And as a matter of fact, in the journals that are what we call in my trade, the throwaway journals, like the one I just got yesterday from the American Society of Clinical Oncology, front page story about this very thing, debates among the experts. The answer is we're going to personalize this depending on the circumstances of the original estrogen receptor positive cancer. Let me give you an example. Big tumor, multiple lymph nodes involved, estrogen receptor positive. Somebody like that has a really increased risk of the cancer coming back elsewhere in their body in the next 10 years. So therefore, I think in somebody like that, you are going to continue the tamoxifen or the aromatase inhibitor, maybe at least another 5 years, perhaps even indefinitely. Mm-hmm. Patients who are stage 4 who are estrogen receptor positive, you're going to continue indefinitely. Now, some of the small stage 1s, maybe under a centimeter in size, well differentiated, there's probably little value in continuing another 5 years of anti-hormonal therapy. So I think it needs to be individualized, and I think this will be what will come out of all of this, okay? Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.